Hello.
Hi.
Hey, how are you? We're doing our presentation on clinical nurse specialist. My name is Ben Nagraki,
I'm Carrie Van Wieren. Jasmine Brooks. Sandy Ratliff.
and we are going to start the introduction with Jasmine. So we are going to step away.
All right. So, like you said, we're doing our project on the clinical nurse specialist. So the clinical nurse specialist is basically bridging the gap between an expert clinical nurse along with theoretical basic principles. So with the clinical nurse specialist, you are going to be an advanced practice nurse with either master's or doctorate degree. You are expert clinical, so you're doing expert patient care. You're also involved with research and evidence-based practice. It does come in specialized areas, so you'll either be specialized based on your area, which could include acute care, long-term care, or like the emergency department or labor and delivery that way. You also can be specialized based on your population of patients, which again is that geriatrics, your pediatrics, your mental health in that area as well. So with the clinical nurse specialist, you are going to focus on 3 core competencies. So the competencies include the 3 spheres of influence that influence. The first sphere is your patient along with yourself. So that is what we talk about as your direct patient care. So that's what is really intriguing about the clinical nurse specialist, because that's pretty much the only one that I've actually seen or researched that has that aspect of direct patient care along with doing that research and that evidence-based practice. So basically your care is deriving how you're going to impact nursing as far as research and creating more opportunities to just be a better nurse and provide better care for your patients. So one of the other spheres is your nurse relationship with your other nurses. So with that, you're training other nurses, you're developing teaching strategies, you're using what you've seen in your research to form the best new nurses possible. And the third sphere is with your organization and yourself. So the organization is the healthcare system as a whole. So you work directly with insurance company like Medicare and Medicaid. You provide things like an example was the clinical nurse specialist. The research provided by those could be the reason why now the yearly pap smears are now free of charge. Insurance companies are not charging for preventative care, so you have now, I think it's every 2 years your pap smear are free of charge. So that's something that research does along with the clinical aspect of patient care, and you're discovering that's something that we need. All right, so why do we need clinical nurse specialists? Well, we all know that people are living longer, so healthcare is going to constantly expand. The medical homes, like people are starting to get care in their homes now, so you need someone that knows patient care along with knowing that expertise in research to actually formulate a better environment for our Asian community. Optimal pharmaceuticals as well. So now that we're doing genetic testing, we're actually getting drugs that's helping people live longer. So when they're living longer, again, healthcare is going to keep expanding. So now we're going to take it over to Carrie.
I'm going to be talking about the educational requirements. Clinical nurse specialists spend 2 to 3 more years in school beyond the requirements for RN licensure, typically completing a master's degree or a doctorate program. A bachelor degree of science in nursing is required. A clinical nurse specialist must also have a current RN license. Generally, schools require 1 to 2 years of direct experience in a clinical setting. Completion of core coursework, like advanced pathophysiology, advanced pharmacology, and advanced physical and health assessment are also requirements. Some of the licensure requirements are a master's degree in a clinical nursing specialty, which is accredited by the Commission of Collegiate Nursing Education or Accreditation Commission for Education in Nursing, and a minimum of 500 hours of supervised clinical practice in the specialty area. You can become a clinical nurse specialist by examination in some specialties, though not all specialties require certification. Some examples are adult CNS, diabetic management, home health management, and public community health CNSs. In general, the certification process for most CNS specialties is 5 years. Requirements vary by specialty and include being an RN, having a minimum number of hours of clinical experience in that specialty, academic class hours, professional publication or presentations, research or other specific demonstrations of competency and expertise. Many states require CNSs to be certified by the license of the state nursing board. These requirements, again, include maintaining your RN license, graduate degree from accredited advanced practice nursing school, and being certified by a recognized CNS certification authority. For Florida requirements, 30 hours of continuing education are required. Unless the nurse is certified by a healthcare specialty program that it is accredited by the National Commission for Certifying Agencies or the Accreditation Board for Specialty Nursing Certification, then they are exempt from those 30 hours.
Some of the clinical nurse specialist job responsibilities, diagnosing and treating diseases, injuries, or disabilities within his or her field of expertise, providing direct basic care, serve as an expert consultants for nursing staffs, and take an active role in improving healthcare delivery systems. Often work in management positions to develop or work with a team to develop policies and procedures. When working and translating research findings into patient care, and they also evaluate research proposals, overseeing design of evidence-based practice studies, applying research results to practice, or coming up with new evidence-based standards and protocols. Some of the standards of care, we are responsible and accountable for the diagnosis and treatment of illness, suffering, and risk behaviors among individuals, family groups, and communities. Clinical nurse specialist practice is the translation of clinical expertise into nursing care provided either directly or by influencing nurses and nursing personnel through evidence-based nursing care standards and programs of care. Not too much I found on organization websites, but I did find one particular is the National Association of Clinical Nurse Specialists, also called NACNS. Supports a wide variety of initiatives by professional organizations to validate practice competencies of clinical nurse specialists.
Hi, I'm discussing the impact the role of the clinical nurse specialist has played on healthcare reform and evidence-based practice in promoting that process. In 2010, there was a whopping $2.6 trillion deficit already in healthcare reform, and it implemented the 2010 Affordable Care Act into play. And with this demand, we also had to meet specialty areas in nursing, and that's where it came about the clinical nurse specialist more into play than it had in previous history. In 2014, there were 72,000 clinical nurse specialists in the United States, as they had estimated, to help, improve this health care reform issue. With this continuing growing profession, it is proven that the CNS, the clinical nurse specialist, plays a key role in the care coordination and the transition of health care. It also has been proven to reduce the length of hospital stays, fewer hospital admissions, improve access to wellness and preventive care, and actually reduce costs of chronic medical condition care. They are the clinical nurse specialist is the leaders in preventing hospital-acquired conditions such as pressure ulcers, infections, and also falls. And again, that also helps reduce the healthcare reform costs that we are facing in the United States. The clinical nurse specialist also uses the evidence-based practice by focusing on clinical changes in practice based upon this evidence that they acquire. However, they do meet challenges in promoting this process, and some of these challenges have been time constraints within the nurses on the unit and within the specialty itself, heavy workloads, and not enough resources to support it. So one of the things that we do at Baptist Health is we actually have a committee that you're allowed to join and implement this evidence-based process and meet goals to meet that. There's different levels, and you get monetary value for that. So it actually has encouraged the use of the process in our hospital more so than it ever has done, and proven to better our practice. To continue to promote this evidence-based practice process, we also need to give nurses enough staffing resources and time to promote this practice. After researching these two areas for clinical nurse specialists, I found that the role promotes quality healthcare services and has shown to decrease healthcare costs. Greater utilization of the clinical nurse specialist role in the future within the healthcare system will continue to improve access to cost-effective, high-quality care for millions who continue to need it. Thank you.
All right, so this concludes our clinical nurse specialist presentation. A little bit about the future of clinical nurse specialists. So it's going to always be an increased need, like what my colleague talked about with the Affordable Care Act. More people are getting health insurance, more people are getting treated, so it's going to be an increased need. Also, we have improved clinical outcomes, and of course that is the main goal of the clinical nurse specialist, to provide the best care for our patients. And it's going to be a positive impact on the entire healthcare team itself. So with the growing needs for nurses and nursing care, CNAs will continue to grow and thrive, transforming the healthcare system as a whole. Thank you.